Dr. Quinn, you said you had one of the craziest mornings you've had in a while. What's going on with you today? What's a snapshot of how many patients are you seeing right now? How many people have you seen that have been vaccinated? And then give us kind of an update on this vaccination situation.
Well, today has been a very unusual day. We've had more than usual people to come in with symptoms and test positive for coronavirus. And it's very disturbing. I mean, we've tested about 7 people today that were positive. That's a lot of people just in one small clinic. But I had a very, very encouraging conversation with a patient. She's about 75 years old, and she tested positive for coronavirus. She was very, very afraid, but I was able to reassure her because I gave her the data. And what I explained to her was, because her history revealed and she confirmed she had both vaccinations and she was more than 2 weeks out, meaning she was fully vaccinated, I told her that the data overwhelmingly demonstrates that she has a very good chance that she may continue to have a little runny nose, a little cough, but she'll recover 100%. And that's what the data is showing. If someone has been fully vaccinated and they contract coronavirus, there's a very small possibility that they will get very sick at all and they will live.
Now, Dr. Quinn, why do you think it's more important now than ever to get vaccinated?
Well, I mean, for just what I just said, I mean, you have to think about it. Coronavirus is an infection that can take your life. And I'm going to read straight from the latest data. The United States Centers for Disease and Control Prevention states that less than 0.004% of people who have been fully vaccinated, like my patient earlier this morning against COVID-19, experienced a breakthrough case resulting in hospitalization, and less than 0.001% have died from this disease. So basically what this means is if you get vaccinated, you can still contract coronavirus. There's less of a chance you can still contract it, but chances are you will be okay. You'll be a little bit sick, but you'll recover and you can avoid going into the hospital. And more importantly, you can avoid losing your life.
Dr. Quinn, you've talked about the coronavirus booster shot before. What is the booster, for one thing, and then who needs to get it? Or since you're saying that people probably won't get that sick, do we have to have it?
Well, it's a good idea because at the end of the day, we want to save lives. And what's being discovered is individuals that are getting more sick than others and losing their life are individuals that have compromised immune systems. And what the Mississippi State Department of Health is focusing on in their campaign to the healthcare providers in the Mississippi community is to really, really focus on people that have had cancer and they're on immunomodulating medications such as chemotherapy, radiotherapy, people who have chronic medical conditions such as arthritis, lupus, and they're on these medications that can stunt the immune system to treat their chronic illness. And also, after that, people that are elderly and then those with chronic medical conditions. These are considered people that are vulnerable. So if they contract COVID-19, their immune system might not be as strong as, say, you, Walt, a young, strapping young man, you know. So it's a good idea for this population to consider the booster shots because they can use that extra immunity, that extra help, so that if they do contract coronavirus, they can fight it even more effectively. And in some cases, their life can be saved.
Now, do you think the masks are necessary, and who should be wearing them right now?
Well, really, right now, according to the CDC, everyone in Mississippi, because Mississippi is a state that has low vaccinations and they have high infection rates. And this is considered a community of high danger, meaning that there's a higher chance that you'll contract coronavirus, and it's very high in the prevalence right now. So it's a good idea in Mississippi that we wear masks in the entire state, because when you wear the mask, you have an extra layer of protection to protect you from those respiratory droplets. But the main thing is we just have to keep pounding Mississippi and encouraging everybody and educating that we need to get vaccinated, because vaccinations are overwhelmingly demonstrating in the data. As I told my patient earlier today, this protocol, it's saving lives.
Dr. Quinn, we appreciate you being here today. You got any other questions?
No, I mean, I
Nobody
think
said
you covered
wrap
right.
yet,
You pretty much covered the booster shot. We might need to get that. You
Right.
said that, you're seeing people who are getting COVID that have been vaccinated, become less symptomatic than other people.
Yeah.
So I think we got it. We covered it, right?
Well, and one last thing, the booster shot is nothing more than the shot you've gotten before. It's just an extra shot.
Extra
And
shot,
it's advised 4 weeks after you've had your second shot, if you've had Pfizer or Moderna. But if you've gotten the Johnson & Johnson, which is one shot, then 4 weeks later, they want you to go ahead and get the Pfizer instead of the Johnson & Johnson, because the Pfizer is showing to be more effective at fighting this new Delta variant. So the bottom line is, let's get these vaccinations and let's save lives in Mississippi, because we need it.
You're right. You're right. Dr. Quinn, thank you so much.
Hey, thank you for
Appreciate
having
being
me.
here.